This is the secret fix to knee pain that no one in healthcare is talking about. I'm going to explain to you the root cause of just about every knee problem out there, with the exception of a traumatic knee injury. Like if you were in an accident and you know for sure that that's the reason your knee hurt. But if you have pain that's crept on, whether it's from a meniscus tear, cartilage damage, knee arthritis, patellofemoral pain syndrome, chondromalacia patella, you had pain when you were a kid, you had pain when you were a young adult, a medium-aged adult, or an older adult, the chronic knee pain that comes on when you're just sitting around, or maybe you became a little bit active, this is the kind of pain I'm talking about. Now focus in here on my skeleton. Here's a thigh bone, here's a kneecap, and here's the shin bones, and then you have your foot down here. Up here's the hip joint. You can see the ball and socket joint right there. Now what I'm going to draw for you here is the tendon that connects the kneecap to the shin bone, and that same kneecap right there is connected to a muscle called the quad muscle that starts at the top of the kneecap and it runs on the front of the thigh right here and actually crosses the hip joint to affect the hip. It's part of the hip flexors. So there's your quad muscles right there. When you work out the front of your leg, you're going to feel the front of your thigh. These quad muscles work the most. On the back of the thigh, you have hamstring muscles that come down and attach up into the hip as well. They go past the ball and socket joint and attach into the pelvis bones. These muscles cross the knee joint down here, and so when they get strong, they pull the shin bone up into the thigh bone right here and compress all the tissues right here between my fingers. And right here what you'll find is cartilage from the meniscus. Let me draw that in green right here. And then you'll find cartilage all around the thigh bone, the end of the thigh bone, and behind the kneecap right in there. When the quad muscle right here and the hamstring muscle in the back of the thigh get over dominant and strong, that you're using them too much, then they'll compress the knee joint. And this is a secret that nobody's talking about. The problem is that you're using your thigh muscles way too much and it's causing compression at your knee joint. And it's just a matter of time before the weakest part of your knee becomes injured. For some people, it's the ligaments inside the knee, like the ACL, the MCL. For others, it's the tendons, like the patellar tendon on the front of the knee. And for others, it's cartilage, like the meniscus inside the knee joints or on the end of the thigh bone or the back of the kneecap. And that would be setting up things like chondromalacia patella or knee osteoarthritis as the years and decades go on. And here's the secret fix that nobody's talking about. The way to get these quad muscles and hamstring muscles to calm down and stop putting so much compression through your knee joint is to get stronger glute muscles. The glute muscles attach to this side of the thigh bone right here at the top, and they form the glute muscle that we all know about on the back of the hip. And there's a bunch of muscles back there. Glute maximus is the biggest one. There's medius, minimus. There's a bunch of little deeper glute muscles that also connect to this area, and they help to control the thigh by moving it in this way. They can extend the hip, that's probably one of their big movers. They can abduct the hip or move it out to the side, but a motion that is kind of a secret that not many people talk about, we talk about it in healthcare, but we don't talk about it with patients very much, is that it controls rotation of the thigh bone. And you can see when we pull this inwards and outwards like that, it rotates this end of the thigh bone and can change the pressures at the knee joint right here. The other thing that it does is if the glutes are weak, your thigh bone is going to want to roll inwards like this, which is going to make those quads work extra and further compress the knee joint right here. So the secret fix is getting stronger glute muscles in the back of the hip so that you can better pull your thigh bone into the right alignment and keep the pressures at a normal amount in the knee joint. If you can begin to get stronger glutes and also begin to work the glutes out in a consistent way where you're using them at the right time when you're on your feet, when you're walking, when you're doing exercises, then you can begin to decrease the loads in your knee joints and fix problems like chondromalacia patella, meniscus issues, all those things that I've talked about. You can begin to prevent them from getting worse, or if you already have those problems, you can begin to get them to calm down and not have to worry about them the rest of your life. This is one major muscle imbalance that affects knee pain that I talk about here on YouTube. There are other muscle imbalances that could also be affecting your knee pain, but by far, if you can fix this problem, by far you're gonna get the biggest results. It's gonna fix 80% or more of your knee pain. Sometimes there's an alignment problem in the knee joint, and that's a fixable problem that doesn't require you to get stronger. I teach you how to do it in this video right here. It's called How to Fix Inner Knee Pain in 2 Minutes. Go check it out and get some relief today.